Patient A comes in complaining of syncope and mentions that he is worried heart disease runs in his family because his sister died of heart disease. It also mentions that he is tall and skinny. After auscultation, we established that the patient has some sort of heart condition based on the heart murmur that we hear. And so then we did an echocardiogram, and it showed that the patient has a dilated aorta, which is an aortic aneurysm. And so then after an MRI, it showed that the patient is clearly suffering from a dilated aorta. And then we did a pedigree exam, which shows that the disease runs in the family and its pattern of inheritance is typical of a dominant trait. And we diagnosed patient A with Marfan syndrome, which is an autosomal dominant inherited disease affecting connective tissue. And a classic characteristic of Marfan's is being tall and skinny. And aortic aneurysm is a common condition of Marfan's. Patient B comes in referred by a physician and experiences breathlessness and erratic heartbeat. It also mentions that he is a dwarf. After auscultation, we noticed that there is a split sound in his heart sounds. The first and the second one are not single snapping sounds, but occur as paired smaller sounds. And with that alone, it's difficult to make a diagnosis. So after an echocardiogram, it shows that the wall between the right and left atria is completely missing in this patient, which is a severe form of congenital atrial septal defect. And the missing wall allows blood reaching the left atrium to cross back to the right side and be pumped through the lungs again, overloading the right heart and making the lungs congested with too much blood. So we did a pedigree exam. And if this trait were dominant, we would expect to see affected individuals in at least one of the parents and in about half of the children. But this patient only has a niece who is affected other than himself, so this pattern of inheritance is consistent with autosomal recessive. And we diagnosed patient B with Ellis Van Creveld syndrome, which is a rare recessive disease. Characteristics include dwarfism and extra digits along with atrial septal defects. And in severe cases such as this, the left and right atria form one single combined atrium, leading to overloading of the heart. Patient C comes in complaining of dyspnea and fatigue when doing strenuous activity. Mentions that the patient is 55 and of normal build. After auscultation, we established that the patient is clearly suffering from some kind of heart condition based on the presence of a murmur. And it's happening after the second sound and before the first sound, indicating that it's happening during diastole. After an echocardiogram, it shows that the mitral valve, particularly one of the leaflets, is thickened, and so the valve leaflets are moving poorly and not opening as much as they should, leading to an obstruction between the left atrium and the left ventricle. This condition is known as mitral stenosis. After the pedigree exam, even though this patient has relatives who are affected with similar conditions, the trait does not appear in either parents or in any of the offspring, which rules out a dominant inheritance pattern. The most reasonable conclusion is that this condition stems from a non-genetic influence, perhaps due to an environmental factor or due to a common pattern of medical history. And the patient did say that he remembered that when he was a child, all his siblings had rheumatic fever. So we diagnosed this patient with mitral stenosis as a result of rheumatic fever. And since the pedigree confirmed that this problem is common to all siblings but not inherited, it shows that it's a non-genetic factor. And rheumatic fever is the main cause of mitral stenosis in adults.